next, how to get rid of aching back pain. Listen up, new moms. You're going to want to pay attention.
Statistics show that back pain affects 80% of Americans at some point in their lives, and there's one group that's especially at risk. So I headed to St. Luke's Roosevelt Hospital to find out more. I'm here with Dr. Ronny Hertz, who is the director of the Pain Medicine Center here at St. Luke's Roosevelt Medical Center on the west side of Manhattan. Today we're talking about back pain, specifically back pain for women who have just given birth. It's a big problem.
90% of people who develop back pain will get better with conservative therapy because it's only due to muscle and ligamentous strain. But 5 to 10% can have something worse, and therefore a physician should look at these people before you decide there's nothing going on. The best thing a woman who is going to become pregnant, what she can do is start doing back exercises before she gets pregnant so that she can stretch her back muscles out, take the load off her back, and as the pregnancy develops, she will be in better shape and will be able to continue doing the exercises that she is doing.
Once women give birth, how long should they wait before they actually try to exercise their back again?
That's a debatable issue, but I think if you have a cesarean section, you probably have to wait probably a month to 6 weeks. If you have a vaginal delivery and you're healthy and you're in good shape, usually it's about 2 weeks. As the baby increases in size, it's going to be harder to lift the baby. There are things that you can do. Number one, you shouldn't do things such as bend over and reach out to get the baby. You should be close to the baby and pick the baby up with your legs rather than with your back. If you're putting a baby in a car seat is also something where you can hurt your back. It's better kneel on the seat and then put the baby in the car seat.
Gotcha.
That will give you better leverage and less chance of hurting your back.
Is there a limit as to how much your baby should weigh when you should stop picking them up?
It's very hard to tell a mother, don't pick up your baby. It's very hard to tell a grandparent, don't pick up your baby. So that really depends on the condition of the individual rather than the size of the baby. But certainly once a baby reaches 20 pounds, if you have a bad back, it's going to be hard to pick them up, especially out of a crib. You have to get as close as possible and then lift them with your legs rather than with your back.
So would a hot bath be great for if you've got a little bit of back pain?
Well, a hot bath is always helpful, and it always helps you. It's not going to really fix your back, but it's going to help your back feel better. You want to get a physical therapist, you want to go to the doctor, you want to make sure there's nothing terrible going on, and usually there isn't. And then you can use heating pads, which you have to be very careful with not to overheat, and you can use warm baths to try to relax you.
Relax is always good, especially after you've changed a number of diapers a day and had a little bit of a crying baby. Dr. Ronny Hertz, thank you so much. It was a pleasure here at St. Luke's Roosevelt Medical Center.
It's so interesting how many things you do with the baby that involve your back, as we were seeing there in the video.
I know, all very good things to pay attention to.
How are you with lifting little Griffin?
I do those things. I get closer. I actually lift him turn him to the side and lift him up because I don't want his head to be back.
Yeah.
But my mother is the one that she has to pick him up constantly when we all do. We can't put him down, and her back is killing her all the time. So I'm going to make sure
well, just wait till he gains weight, because one of my problems was, no, seriously, is I kept carrying my daughter longer than I probably should have, and they get really heavy.
He's a stocky little boy, too.
Oh, but he's so cute. Who could resist?
I can't.
He's so cute. Maybe you need to start, you know.
I got a pinched nerve. Maybe I should start working out. I'm going to go CrossFit with
But that's what babies are for. You lift them, you lift them.
I'm getting enough. I'm getting enough. All right, well, we'll be right back.